Today's called Keeping the Conversation Going, a collective voice, and it's about bringing people who work in the area of arts and health together to see how we can develop the conversation in Scotland.
We're all cultural beings. We all benefit from involvement and exposure to cultural opportunities, cultural experiences. Voluntary Health Scotland is the national intermediary and membership organisation for voluntary organisations in Scotland that are involved in helping people's health and well-being. So people who are experiencing the greatest health inequalities tend to be the people who also don't access culture and the arts. And so if your health is poor already and you've got less access and less opportunity in terms of culture, then it's arguably compounding your health problems. So that's one of the things organisations in my network want to address. So community level arts is undoubtedly good for people's health, but I think there's a big gap still in how the NHS sort of recognises the value of that, and certainly there's a big gap in terms of how public sector would invest in that, because community-led initiatives that involve people in arts on their own terms, led by them and reflecting their own culture, is incredibly important but is underinvested in. Now, if you think of the amount of money that's invested in the NHS, think of just taking a little bit of that and investing in arts at a community level as a preventative measure for ill health arriving in the first place, then there's some health economics there that would be interesting to look at. And I think there'd be some good answers in terms of the value of people-driven arts.
So the arts can have a role to play in soft outcomes that people are trying to achieve within the health service.
Some of the organisations here won't be specialist health organisations or specialist arts organisations. There'll be charities that work at a local level with people whose health and well-being might be fragile, either physically or mentally, and what those organisations do is they use the arts, whether artists or other sorts of art interventions, to support those people's recovery, well-being, enjoyment of life, quality of life.
There's been lots of work done in England, Wales and Ireland in developing the arts and health sector, and Scotland is now looking to see how it fits into lots of different national developments.
Well, the interesting thing about Arts Care as an organisation is that about 28 years ago it actually emerged out of the Department of Health in Northern Ireland. So it's very unique internationally in that sense, in that it's an arts organisation that has come out of a Department of Health, and that's just terrific. So since then we have had real great buy-in from the Department of Health, from the healthcare trusts and from the public health agencies. So we are a small regional province that has 5 health and social care trusts in it.
If you step back a bit, there's a role for art and design in healthcare environments in trying to make them more human, less anonymous, less scary, less creating anxiety. There's a role for the arts in relation to treatment where people have conditions or long-term conditions, and whether you're helping them to recover or helping them to cope. And then there's a role for the arts in terms of the preventative stuff, how arts just makes you healthier for longer. Across all 3 of those sort of very broad categories, there's such a lot of evidence.
But I think it highlights to staff and to patients and to families people's disabilities that they don't necessarily associate with them being in a hospital, and giving them access to opportunities and creativity that they've maybe not had at other times in their life.
We would have, for example, 4 specific programmes, and our key programme is our Artist in Residence programme. So that is locating and deploying artists across all art forms really into residencies, and those residencies may be 2 or 3 days a week across multiple healthcare services. And then we have a large scale project programme as well, which is a one-off programme, or programmes that may last from 6 to 12 months, and they are commissioned programmes really for our artists also to go into different environments like older people in dementia, young people and adolescent mental health and counsellor services, etc. Just a wide range, including staff services is one of the big areas in which there's a huge development in Northern Ireland in using the arts and really using creativity and focusing on that to enhance professional development for healthcare staff and students.
I think what's lacking in health, if I'm allowed to say that, is a sense of real kind of embodiment, really, and bringing the physical into the work. I mean, medicine is a very physical activity and can't remain just a conceptual thing. So I think my dance training has helped me think on all levels, and because we are really keen to get people into physical activity as well as things like writing and music. I think it's a great combination, really. I love using my dance experience in everything I do. I'm working with Scottish Ballet at the moment, which brings me to Scotland with their dance health programme, and they're working in Parkinson's, multiple sclerosis and dementia, and with young people, doing extraordinary work. So part of me being here today is sort of bringing these things together, looking at what the network is doing, seeing if I can create links there. But finding out, I'm here to find out and listen actually, because I don't know very much about the Scottish scene yet. I've been researching quite a lot for my work with Scottish Ballet, but I want to meet people here today, and then I think it's what happens after today, which will be the telling thing.
Well, I think one of the significant things that I would like to see, and I know our organisation would like to see, is just more links across the UK, really. And what's very interesting in the conversations I've had so far, even today, and they have been very brief, has been the similarity of work that has been going on, but how essential it is for the field of arts and health to actually bring those links together so that the voice is stronger, and that we're looking at how we further develop that practice and benchmark quality. There's a lot of challenges within the work, and I think that coming together across the UK, that actually that is something that we can resolve and set up as best practice here in the UK.
So unfortunately Angela isn't able to be here today, but we have a video presentation from her.
Sharing best practice and advocacy.
What struck me about what's going on in Wales that's really interesting is the fact that Angela leads a sort of practitioner organisational network. There is also a memorandum of understanding between the NHS Confederation and Arts Council Wales, which is generating structures for case studies to be digestible. Then you've got a cross-parliamentary group in the Welsh Assembly, which is meeting regularly on arts and health, an emergent arts and health research network led by Bangor. So these elements are, at the moment, it appears, working incredibly effectively to create a matrix of activity that's mutually supportive. So nobody's trying to do everything. The right people are doing the right jobs. The practitioners and the organizations are developing the practice. The policy people are developing the policy. The politicians are having the conversations. The researchers are building the research. And that seems to me to be really smart.
I think one of the most significant things really is to build relationships, and I think knocking on doors always works. Straightforward. You might not even make appointments, you may knock on a door, but I think that you really have to develop those conversations, and you have to use the relationships that you have built at local level with healthcare staff as well as the service users, and then you have to go straight right up there and ask for what you would, or build a vision. I think that's what we've been doing. We've been building visions for the Department of Health, and we have been, I suppose, placing our services where the need is greatest, where they see their need is greatest. So for example, at the minute it's around suicide in younger people and young people's adolescent and mental health, also older people's mental health, older people with dementia. So we are really partnering across many projects and multiple projects with our health agencies there.
I think today is about bringing together everyone who's expressed an interest in arts and health in Scotland and consolidating the work that we've been doing over the past few years.
And also to value the artist and pay the artist a decent wage as part of the project.
Being part of something really inspiring and something bigger, being part of a collective voice.
For me, it was really important and really interesting to hear from all over the UK. And the important thing, I think, is evaluation and how we make it effective, but without it becoming so clinical. That's important.
I think co-planning between the arts sector and the health sector moving forward will be a really good